showing Abublushi. Abublushi is the e-waste capital of the world. See, the whole world. The whole world. And you know e-waste. In fact, the picture is so illustrative. There was research taking cord blood from babies born to mothers who lived in that area. And the percentage of lead in the cord blood was very high. Because, you see, because of the activity that takes place there, the metals seep into the soil, okay? And it's in the environment. Or let's say exposure to, there are things that you can't control. Exposure to radiation, for instance. Sometimes people come to radiotherapy and they are scared. I give them a Geiger counter. Say, go and stand in the sun. And it ticks. And when they come inside, it doesn't tick. They said, see, there's cosmic radiation. See, so there are some risk factors that we cannot control. But then there are risk factors that we can control. And the modifiable risk factors we have to deal with. Policy. Ghana has a non-communicable control strategy as well as a strategy for cancer control. The cancer control strategy document is based on the cancer control continuum consisting of prevention, early detection, diagnosis and treatment, and then terminal care. Communication and behavior across cancer control continuum should consist of the following. Prevention. Under prevention, you have tobacco control, diet, physical activity, virus exposure, alcohol use. Under early detection, you have pap test, mammography, fecal occult blood test, PSA testing, sigmoidoscopy, and early diagnosis based on education to enable informed decision making regarding health-seeking behavior. You see, but I have a problem with the education. I have nothing against the UN Day celebration. For instance, I think 2 days ago or so was World Diabetes. Okay. We'll talk about it, and that's it. Until next year. You see, but if policy is implemented at the district health level, where district health management teams go up, and you see now it's only communicable disease that they are tackling. The community health nurses can be trained to also give education on non-communicable disease. By so doing, you will have countrywide penetration, you see, and it will be addressed in a systematic fashion. It will not be ad hoc. As we have it, it's ad hoc. Unfortunately, in Ghana, we like making, when people come out and make in quote noise on those days, then in between we are quiet. We are happy. The underpinnings of cancer control continuum include multi-layered peer support. You see, so it's multi-institutional. For instance, the children during secondary school can be taught about these things so that they are knowledgeable. If you say somebody is literate, it doesn't only mean that he knows how to read. You must know about your health. So we can place in school curriculum. Sports. When we were growing up, you see, 7 years from 1 to upper 6, and when you start from 1, you see the upper 6 guy, you see that yes, he's a grown up, and sports was very competitive. Very competitive. But because they spend only 3 years and the concentration is so much on academic work, you know, they don't participate in sports. So now we have obese children. Specific actions to be undertaken with respect to risk factors as follows. Tobacco, reduce affordability of tobacco products by increasing tobacco excise taxes, create by law completely smoke-free environments in all indoor places, warn people of the dangers of tobacco and tobacco smoking, ban all forms of tobacco advertising, harmful use of alcohol, regulate commercial and public ability of alcohol. It's in our strategy. Yet we have Adonko Famico. And it's so glaring. It's so glaring. Prime time. Prime time. And we are advertising alcohol. Oh, please, I don't have anything against the company. But then we have it as a policy. We have it as a policy that we should regulate, restrict, or ban advertising and promotion of alcohol use. Yet, we flout it. Diet and physical activity, reduce salt intake, replace trans fats with unsaturated, and so on and so forth. Health effects of overweight and obesity. The health effects of overweight and obesity in 195 countries over a 25-year period has recently been published in the New England Journal of Medicine. It revealed the following important findings. The prevalence of obesity has been increasing steadily worldwide over time. Among adults, the prevalence of obesity was generally higher among women than men in all age brackets. The peak in the prevalence of obesity was observed between the ages of 60 and 64 among women and between the ages of 50 and 54 years among men. The Global Burden of Disease 2015 Obesity Collaboration, this was responsible for that publication, defined socio-demographic index as a summary measure of distribution of income per capita, average educational attainment among persons over the age of 15, and total fertility rate to position countries on the development continuum. In general, prevalence of obesity increased with the increase in SDI, that is socio-demographic index, across all age groups. During the period from 1980 to 2015, the most rapid relative increase in the prevalence of obesity occurred among men between the ages of 25 and 29 who were living in countries with low middle SDI, like Ghana. Cardiovascular disease is the leading cause of death, 41%, and disability adjusted life years, 34%, related to high BMI, followed by diabetes. Chronic disease was the second leading cause of BMI-related disability adjusted life years in 2015. Chronic disease and cancers account for less than 1% of BMI-related death in 2015. So obesity and overweight are responsible for kidney disease, cardiovascular disease, and so on. According to Health Growth and Mortality Reform, chronic disease in Ghana, the incidence is about 7 per 100,000 people. But what is important is that it has increased by 10.6%. That is chronic kidney disease, increased by 10.6% since 1990, averaging about 0.5% per year. Risk factors associated with kidney disease in Ghana are high systolic blood pressure, high fasting blood glucose, high body mass index, dietary risk, and other environmental risk in decreasing order of importance. In order to stem the tide in relation to death and disability adjusted life years due to obesity, healthy diet and increase in physical activity are recommended. So we should eat small portions of high calorie foods. We shouldn't eat the fufu, big ones. We should eat small portions. We should choose vegetables, fruits, and other low calorie foods instead of calorie dense foods. We mentioned French fries here. I thought I should take out the French fries. Then I realized that now there are so many KFCs springing up, so we should still be there. Ice cream, donuts, and so on. See. Eat a healthy diet with emphasis on plant food. Don't eat a lot of processed meat and red meat. But I have a comment there. This patient comes to me, it's a cancer patient receiving chemotherapy and radiation. Now, HB is consistently low. So, you try to treat it, but then you try to find out why. Apparently, he's been told that you shouldn't eat red meat. You see, so we don't put the messages in context. This person needs the red meat. Okay. Ghana has about the lowest consumption of milk in West Africa. So if you come to tell us that we shouldn't take too much of milk, already our consumption is way down there. It's the same with meat. See, there's in one of the textbooks which we refer to, there's a graph showing meat consumption per capita and the development of cancer. And the countries listed there, you know, Australia, New Zealand, and so on. You see, because they eat red meat a lot. In our setting, it's true, red meat has problems, but are we even taking enough for us to have correct HBs? Regular physical activity of at least 150 minutes of moderate intensity physical activity per week for adults reduces the risk of cardiovascular disease, diabetes, and cancer. Children and young people aged 5 to 17 should accumulate at least 60 minutes of physical activity of moderate to vigorous intensity daily in order to maintain and improve cardiovascular health, muscle fitness, bone health, metabolic health, biomarkers, and mental health. So they say if you exercise, it affects your thinking. According to WHO, there's a causal relationship between harmful use of alcohol and morbidity and mortality associated with cardiovascular disease, cancers, and liver disease. Implementing very cost-effective population-based policy options, such as the use of taxation to regulate demand for alcohol beverages, restriction of availability of alcohol beverages, and bans on or comprehensive restriction on alcohol advertising are key to reducing the harmful use of alcohol and attaining this target. So health professionals have an important role to play in reducing the harmful use of alcohol by identifying hazardous and harmful drinking or alcohol dependence in their patients and by providing brief interventions and treatment. So what is harmful use of alcohol? Harmful use of alcohol is defined as excessive drinking per day of more than 2 drinks for men and 1 drink for men. So you can take more than the women. Binge drinking not exceed 5 drinks men and 4 drinks in women. So 1 drink equivalent to 330 ml of beer, 240 of malt liquor, 150 wine, and 45 ml of age-proof distilled. So it depends. The volume you take and what substance you take determines the volume that is allowed. NCD risk factors in Ghana. So all that the statistics that I gave was general, but specific statistics in Ghana, proportion of women aged 50 to 49 who are overweight or obese increased from 12.8% in 1993 to 30% in 2008. Less than % of adults eat adequate amount of fruits and vegetables. 20% of adults in Greater Accra report heavy alcohol drink preceding a survey. About 86% of adults in Greater Accra region report low levels of physical activity. But these days, I'm sure it's getting better, you see, because on the Buri Road, you see people working out. But probably they are the educated ones. The prevalence of smoking and tobacco stood at 7.8% in males and 0.3% in females as at 31st December 2016. You see, so we don't smoke too much, 7.8%. But then a world study reported as 13%. So I don't know which one is true. Probably the demographic, Ghana demographic and health survey is correct. I think so. I don't think it's as high as 13%. Now the laws, Framework Convention Tobacco Control in Ghana, it states that a person shall not smoke tobacco or tobacco products or lighted tobacco products in an enclosed or indoor area of a workplace or any other public place except in a designated area. But we have designated areas. As stated by Section 58 of the Public Health Act 2012, Act 851. The Act also mentions public place to include, but not limited to, the following: all workplaces like factories and offices, and so on. A roadmap to tobacco control legislation. Public Health Act 2012 is the primary tobacco control legislation and governs, among other things, smoking in public places, tobacco advertising. And so what I want to state is that it entered into force on the 4th of January 2017. So there's a grace period of 18 months for which changes have to be made regarding advertising. So in conclusion, there is incontrovertible scientific evidence that lifestyle changes in respect of known modifiable risk factors translate to a decrease in the likelihood of developing NCD. Although the policy framework on NCD is in place in Ghana, implementation is rather poor due to inadequate funding and commitment. While UN celebration days are important, they represent an ad hoc means of education if there is no systematic way of countrywide education all year round. Prevention, early detection or diagnosis, treatment, and palliative care activities should therefore be integrated into activities of district health management teams in order to ensure countrywide penetration of interventions. The policy on the use of alternative and complementary medicine should be streamlined for it to have positive impact on health-seeking behavior. As it stands, there are conflicting messages between orthodox medicine and alternative and complementary medicine. Data acquisition structures should be strengthened to improve accuracy and coverage. Establishment of specific disease registries should also be encouraged. Thank you.
Can we please give once again, we must apologize to both presenters especially, but the audience also, for the failure of the electronic equipment which could have given us the benefit, additional benefit of what looking at illustrative examples of some of the points that were being made. But the presentations clearly outlined a number of things, and I'm happy that both presenters were not only giving us the facts of the case, but also dwelling on measures that we could take at the policy level, at the individual level, to make sure that even though health challenges might be unavoidable, when they do occur, we could do our best to minimize the impacts on our individual and collective lives. The young people in the audience, please take note. It may be too late for some of us, but you can benefit from what? The many suggestions that have been made that could help you prolong your life. It's very important. The thing about the communicable diseases, you were laid out. Some of it are beyond our individual controls. And by the way, I keep wondering why we can't link up the health service with the engineering service, civil engineering. We leave all our gutters open, and then we complain about what? Prevalence of malaria and problems with cholera. So perhaps some policy measures must be put in place to compel those who design our road networks to cover the drains. I mean, this is done in most places. Why in this country we leave all our gutters open and then complain that mosquitoes are too many in the environment? It's something that I have difficulty understanding. There are future engineers in the hall. When you become one of the engineers designing our road, please keep this in mind. It could make a difference for communities. But let me leave it, because the program was delayed by 30 minutes waiting for the technical challenge to be solved. We've taken more time necessary, but it will be unfortunate if we don't give an opportunity for at least a couple of questions. And if we can have a few questions, quick, brief, and get quick, brief responses from the presenters before we go. Yeah. There's one here.
Thank you. My name is Legon. My question goes to Dr. Yarney. The statistics given seem to suggest that those who are in the high earning brackets and developed countries stand at risk, the high risk of getting the non-communicable disease. I don't know if because of lifestyle or anything, I need explanation to that.
Please, my question is to Professor Yarney. Please, I want to know if there is any good way of using alcohol, because you made mention of harmful ways of using alcohol. So I want to know if there is a proper way of using alcohol. And then the second question also is that those in the rural areas who are used to this herbal medicine and stuff, are there any measures that can be put in place so as to make them adapt to the modern healthcare? Thank you very much.
My name is James. My question is that since we are all saying that cigarette and tobacco smoking is not only affecting the smokers, but then also affecting those who are around, why don't we put a ban on cigarette and tobacco? And then my second question is that I heard Professor saying that an application ends. Please, we would like to know the meaning of NCD. Thank you.
Well, we want to just go one round because of the time, so let's take that last one.
My name is Michael Wilson from Noguchi Research. Mine is a suggestion. And if the person want to add to it, fine. It is this, that you always see when they are doing statistics about indicated alcohol, you see contributions of agriculture to GDP. You never see that for health. But I believe sincerely, health also contributes to good health, contributes to GDP. Somebody please explain why we don't have this disease.
Thank you very much. My name is Korle. I'm with the Ministry of Agriculture as an extension officer. I want to ask Dr. Yarney that I learned, I don't know that excessive exposure to radiations or radioactive or nuclear substances can be harmful to your health. And how frequent is it that when you're exposed to it, how frequent does it affect your health? Thank you very much.
I had a couple of questions, or maybe three or so. The first one was from, I think, Mr. Thomas, about development and application of malaria vaccine. I mean, we can have talking about malaria vaccines, but basically the main situation is there's a lot of work going on to develop a vaccine for malaria. One has been tested. You heard that out from the independent data monitoring committee. We've been looking at this for the past almost 10 years now. When the studies have been going on. The RTS vaccine by GSA. The result of it was that it was not as effective as we would all hope. I mean, the best protection which was obtained in all those states needed the booster. If we didn't have 4 doses of that vaccine, the protection was very low. And the younger children, infants to 2 months or so, after 6 months, the effectiveness was very low. More working than by our workers trying to do this. But my take on that really is that even let's say at the end of the Second World War, for example, malaria was beaten. In fact, CDC in the US actually started as a malaria control program to control malaria in the southern part of the United States. So malaria has been a disease which affects or has affected mankind for a very long time. And when people are taking a decision that we don't want to have this, they try away with that long before we even thought about vaccines. So whilst it's good to have a vaccine, I would say that we probably should not dwell very much on or put all our hopes on having a vaccine. I will digress a bit. I mean, one of the things which I always find amusing to say is when I see work on, I mean, it's nice to work on vaccines and things, but when I see that people are proposing that we should have something like a cholera vaccine, my question is, do we live in the field forever? Why should we have to take a vaccine against the response? So, as a public health physician, if you ask me to go and distribute cholera vaccine, I probably would like to use the money to do something else. I will do it. The other question was, I think, around levels, which we wanted to find out what is happening there. Leprosy is similar to TB, but leprosy, borreliosa, and TB all affects the surface of the body, so opens the lungs or the skin for leprosy and borreliosa. Leprosy used to be around. I'm not very conversant with the current figures, really, but most of the cases that I remember were left associated in the various treatment places and things. And I think the only one I know of probably is people still have in their wage and maybe Ankafu or something, but I don't really know the number of people in Ankafu at the moment. And I know one of my colleagues in Noguchi was actually trying to see whether what's the link between that person and borreliosa and what else still have some problems and competition around. So maybe when she's not doing, we have some more information on that. The question about seasonality and communicable diseases, yes, most of them are seasonal. As I said, this a battle between us and the microorganisms. If they find the right season better to be able to spread, they will be out in the right season. So we will well advised to know what we have to be the right season and how we have to face the right season because they have to survive. And that's the time that will give us the best opportunity of growing up. I lived in those areas for 6 years, as I told you. I saw one large epidemic as all I had as a young man. And there's a things we will have to do. How we tackle it, for example. Because I remember when we arrived and we didn't say that, look, this is going to be an epidemic. We got a good response, went in and did what we had to do. In 1996 or so, around 1994, there was another epidemic. One of my colleagues who was still in the region did report to the national level and says, if we start seeing cases soon after the range in October of meningitis, we're going to have problems. I need to vaccinate people. People told me that I can be telling us to vaccinate people in October. His letter was dated 15th October. I know this because they sent us to where the people are actually kids. This is somebody who's now in their 10 days and so if we start seeing cases as early as the end of October, we better vaccinate around the cases and control them. We can't get the vaccines, we can't do this, we can't do this. We waited until January and we had a big exclusion. And when we said, well, I recorded the thing, nobody got it. So we did this. So it's the thing that the price is the time that we don't have it. If you look at the vaccines, you know that, as I said, middle, if you start seeing cases before Christmas, you're going to be in trouble. Because basically there's a longer period of time for riots, for the budget, for market things. So
reduction mechanization, food became abundant. So now, maybe very for one, this activity. My primary school, I grew up with the basic education on the South. My father was with his Christmas and I attended the university. But I still want to school. See, but now for kids to see, so this activity
depending the way you use it, it's helpful. You should school the way you use it, and you should use it like a full treat. There was a comment from my colleague proposal, which I think is a very good thing, but unfortunately, may not be good thing. But I think it's something we could engage with the Economics School of Public Health and other things. And maybe the Department of Economics to actually try and make the case for investment in health, so that you can say, if we prevent so many cases for something, I think it's something that we should do. So thank you very much.
Well, let me bring this this evening's program to a close, and once again thank the presenters, but also thank the audience for your patience. We've stayed much longer than we should have done, but I guess our lives depend on what the presenters were telling us, so it was good that we had the patience to listen to them. Just one little point here, especially to the young people, that thing about alcohol, just take note that a trend has come in now where many of the popular places that are selling akpeteshie and other drinks are putting things in the akpeteshie. So it's not just the akpeteshie that you are drinking. It's spreading gradually. That many akpeteshie sellers have, in some cases, wheat or something else in their akpeteshie. And they cater to particular customers, but you may not be one of those customers, and you may not know that there is something else in there. So don't go around, being enticed to go and take just one little thought, or you might go home with more than the akpeteshie. Thank you very much.
Shall we give the chairman another round of applause? It's been a long day, but thank you very much for steering us to the end of this session. For tomorrow, we would have the climax of the Founders Day. We would have the Kwame Nkrumah Memorial Lecture on the topic Kwame Nkrumah, the Man and His Legacy. This will be delivered by Professor E.S. Ayensu, and it will be here at 5:30 p.m. tomorrow. You are all welcome. I want to acknowledge the presence of 3 schools: St. John's Grammar School, ATTC Kokomlemle, and then Presec Legon. Thank you very much. It's been a long day, so please let's get up and close and go home in peace. Shall we please rise for the party here to depart?